Advances in medicine are making new life possible. Doctors say 2 out of 5 women suffer from tumors that usually lead to hysterectomies. But News Channel 3's Cheryl Kepis is on your side with a procedure doctors in the Mid-South are using, which leads to a different outcome, giving women a chance at motherhood.
Michaela Myers thought she was healthy, but during a routine exam, her doctor discovered Michaela had tumors, several of them.
I was amazed. I had no idea.
Michaela's like many women in the U.S. who have uterine fibroid tumors. The non-cancerous tumors can cause pain, swelling, heavy bleeding, and other health problems.
They can be small, about the size of maybe a gumball, but they can range all the way up to like the size of a large grapefruit.
For years, the only option for women with fibroid tumors was a hysterectomy. Dr. Zeni inserts a tiny tube into the arteries that supply blood to the tumors. He then releases sand-like particles that cut off the blood supply to the tumors, causing them to shrink.
Over 90% of women who had the procedure said that they would have it again. And that's very unusual for most procedures that are performed in medicine.
The treatment worked for Michaela. Her tumor shrank, she feels better, and that's not all.
It made all the difference in the world. By having this procedure, I didn't have to go through the trauma of the trauma that a hysterectomy brings. I was able to continue with an active life, and most importantly, I was able to conceive.
Almost exactly a year to the day of the procedure, Michaela gave birth to Ivan. The bright-eyed 19-month-old brings a world of joy to Michaela, and she's thankful for Dr. Zeni and a treatment that's given her a new life. In Memphis, Cheryl Kepis, News Channel 3.
Dr. Zeni says the studies show years after the treatment, the tumors remain small and don't grow back. And fibroid tumors are very common. According to researchers with the University of Maryland, about 1/3 of all women have them. African American women, however, have a greater risk. As many as 50% of African American women have fibroids of a significant size. That means they need treatment or attention from a doctor. 20 to 40% of all women ages 35 and older have fibroid tumors that also are of a significant size.